Okay. All right, so I created this program about green dentistry since January, but I didn't take into account for all the new requirements we'll be having after the new PPE and everything. So I assume there's just going to be more waste associated with dentistry. So just keep that in mind through the presentation. And I'm doing this through Eastern Washington University. All right, so this is what we're going to go through today, is to define what green dentistry is, to assess the waste in the dental industry, determine the OSHA compliance, and to recognize in-office green dental alternatives and understand patient green dental alternatives as well. So what is green dentistry? It's an eco-friendly dentistry, is an approach to dentistry that implements sustainable practices by keeping resources consumption in line with nature's economy, by safeguarding the external environment through elimination or reduction of outgoing waste and promoting the well-being of all through the clinical environment through conscious reduction of the chemicals in the breathable air. And this was a quote from one of the first doctors that kind of implemented this into his practice. He has a franchise on the East Coast with about 30 practices that uses green dentistry, and he's the only doctor that's doing this right now. All right, so this is when we're going to text to poll, and we're going to see the knowledge that you guys have about green dentistry before. So text what you think the answer is on what recycled programs are available out of these three things, and see if it works. Did anyone text their answer to that?
Yes.
Okay.
I was a little late in doing that. I just joined the text group.
Sorry. So the answer to that first one was what recycled programs are available, and it's gloves, actually nitrile gloves. But we'll move on to the second one, and that's what are methods of producing less waste. And so out of all these answers, did everyone send theirs in?
Yes, I did.
Okay, so it's D, all of the above. Okay, and then what are biodegradable oral hygiene aids composed of? Cornstarch, silk, paper, bamboo, all of the above, or none of the above? I'm texting my answers too, just to make sure. So the answer to this one is all of the above. So it's E. Mostly everyone got that right. And then what are examples of waste in the dental practice? Gloves, energy, water, or all of the above? Okay, so the answer to this one is all of the above. All right, so the waste assessment of a dental practice, everyone probably knows this, but like single-use plastic barriers, oral hygiene aids, cotton, latex, dental materials such as amalgam, silver or lead, biomedical waste such as blood-soaked gauze, and like I said, there's probably an increase in all these things after we go back to work with the new precautions that we have. I didn't know if anyone else read, but with the disposable gowns and that type of thing, there's just going to be an increase. And then so for OSHA compliance, I do not decrease barriers in order to reduce waste. Instead, you want to use items that are OSHA compliant, but alternatives. So that would be like paper barriers, eco alternatives like the bags that we used when we were in school that you can autoclave, and then some reusable instruments and suctions like stainless steel suctions and that type of thing. For green alternatives in office, like I said, like a green sterilization procedure with the Enviro pouches. One thing on those is you do have to see, you do have to look and see they have a maximum amount of time that you can use them for. So we don't use those in our office, but you would have to kind of indicate when you're at that point. A stainless steel reusable suction that you can autoclave, supporting products that use less packaging. There are some that use like paper packaging or ship it in one box rather than multiple shipments, that type of thing. And then like paper barriers instead of plastics that you can use. Another thing that you can do in office is switch to LCD computer screens, be paperless. Does anyone work in an office that's not paperless? I know. I've only worked at a few that had charts still, so I just wanted to make sure. But sending all the paperwork via email in a secure system and that type of thing, just to reduce paper waste. Turn off lights or have motion activated lights. Motion activated sinks and toilets and that type of thing. You can use air dryers rather than paper waste for patients. That sort of switch that you can make. So the recycle programs that I found available for dental offices, obviously the standard plastics, glass, paper, but there's also a couple others, which is like the nitrile gloves that I talked about. There's TerraCycle or the Kimberly-Clark nitrile glove program. And she's actually a dental hygienist that created this program out of California, and they send you a box where you can recycle your gloves, which does make a difference in offices. I've not seen either of those in an office though, so personally I don't know how it works, but that is an option. And then Colgate has a program where you can recycle used tubes of empty toothpaste. It's with TerraCycles, how they sponsor that, but I have a link to that at the end if you guys are interested in that as well. And so the green alternatives for patient aids, one thing I will say about all these things, I haven't looked up efficacy of any of them, so I'm not entirely sure, like compared to the gold standards like Glide Floss, that type of thing, how effective they are. Not a lot of them have studies yet, so I'm doing my thesis on biodegradable floss picks because they're available to buy, but they don't have any evidence saying if they're as effective as like the gum brand and that type of thing. So I would say if you are suggesting something like that, I would look into that a little bit more. Some of them have newer studies, like 1 or 2, but a lot of them don't have anything yet. So when you do mention that to patients, I wouldn't say you're quite sure. But instead of using like the plastic oral hygiene bags, you can use a biodegradable like paper bag, or you can have your office switch to like a cloth bag and then promote that, where you could have the patient, if they bring in their bag, they get the free brush and that type of thing. It is a little bit more upfront, but it does in the long run end up paying off. They do have silk floss, so instead of like the gum floss, they have what's called dental lace, and it's in a glass packaging, so you don't have to worry about anything like that, and they just send you the spool so you don't keep getting those plastic containers. Another product is Radius, which is similar to the dental lace. They're a little bit more expensive than regular floss, I will say that, but if you have patients that are interested in being eco-friendly, those are options. And then for biodegradable floss picks, they have The Humble Company or Hello are the two brands that I know of. They use charcoal and cornstarch in their packaging, and so they're a little bit more eco-friendly. Um, Bamboo toothbrushes instead of plastic toothbrushes. Obviously, if you're saying a Sonicare, I wouldn't suggest a bamboo toothbrush, but that would be an alternative to the plain standard brush. And then promote brands that use less packaging or paper packaging. The two that I know of is Cocoa Floss. They use cardboard instead of plastic, and then they also send you the spools. They're expensive, but they do sell now in Target, on Amazon. They're at like Anthropology and a bunch of stores like that. So it's easy to find for patients. And then the Burst toothbrush uses paper packaging as well. I've used the Burst brush, and I'm not sure if it's as effective as a Sonicare, but I know Sonicare doesn't have any programs yet for recycling their brush heads or using less packaging. So that's one thing I did kind of look into as well. Does anyone have questions about any of these things yet? Awesome.
No, I think I'm good. Thank you.
And so the goal of this would be to have you guys each make one goal to implement green dentistry into your practice. So out of all the things that I've kind of mentioned, what do you think that you could implement?
Do you know if the Colgate recycling program takes other brands of toothpaste like Crest and Sensodyne and stuff,
Yeah, they do. They
or
take
just
all the
Colgate
tubes,
products?
yeah, of empty toothpaste, but it is a Colgate sponsorship. So Colgate and TerraCycle send you the boxes.
Okay.
And
So,
the
but
least
they
amount
would
is
take any of the products, even the
yeah,
big plastic bottles?
yep.
Okay. Cool.